Yeah, I've put up a Google document in the chat window, a link to it, and if you're interested, you can click on it to see the questions that we have already asked to the panelists. And the idea is that we have a wide range of expertise in our audience, both in person and online. So the panelists have already talked about a lot about these things, but we would also like input from the audience, or if the audience has any specific comments or questions to the panelists, or to answers to our questions, you're very welcome to contribute to the discussion. If you have questions, you can just type in the chat window, and if you have comments, you can either raise your hand or type in the chat window, and then we're gonna start, the discussion among ourselves. So before we start, well, actually, yeah. So I'll give you 1 minute to think about the questions, and if you have any questions to the panelists, you can type in the chat window. And our panelists are still here, and if the panelists have any questions to each other, you're also welcome to just unmute and talk.
Maybe I'll just start and ask Barry about the social media as a source of signals, and how far do you feel that we are down that route, that social media, and what aspects of social media can we expect in the future as being a source of early warning signals, or a potential source? You may have covered this, of course, in previous parts of the workshop, which I haven't been able to take part in, unfortunately.
So no, I haven't covered that, but I mean, social media in many respects is bigger than it's not something we should ignore. There's always a lot of things going on there, a lot of wisdom, but also a lot of noise. There are probably very good questions to be answered from social media, especially if you're also looking at combining it with efforts such as crowdsourced efforts. On the opposite side, social media, of course, has its dark characteristics, and people will often do weird things to thwart algorithms that use it. There's a fair bit of noise already built in with allowing people to remain anonymous, which is generally a very good thing, but it also comes with its limitation, and that includes people hiding their geographical location. So that limits things like making geographical inferences. So even if people do indicate their geographical location, that might not be accurate. So there's probably a lot of noise to be dealt with. On the opposite side, there is so much of it that certain noise reduction algorithms may well be quite successful. I think in general, it fits in my cause and agenda point is that there's no source of data that you should ignore. Valuable channels might come from all directions, so it's always good to keep an eye on it. Within GFIN, I have to repeat what Dave said. There are a limited number of Twitter feeds that feed into GFIN, and those are the feeds from vetted and respected epidemiologists that that send messages out through Twitter. So it's not that we're completely excluding anything from Twitter, but it's just highly curated.
Thank you. As Barry is leaving around 3, am I right?
There's Nick, I think, is leaving at 3.
Oh, Nick is leaving at 3. Thank you. So it's already 2:50. So if anyone has any questions or comments to Nick, I guess it's the best time to raise it now. When you raise a question, please introduce yourself, then ask the question.
Hello, so I'm Tanya Phillipson. So one of my questions, correct me, you are working a lot on climate modeling. Is that correct, if I remember that right?
Yes.
So I guess maybe I have 2 questions. Let me try to formulate them well. So one thing that I was kind of thinking about is, there has been a lot of climate modeling and essentially early warning systems in the past, but there hasn't been maybe as much response as there should have been, maybe, if I say that delicately. So in terms of, let's say, early warning systems for emerging diseases, do you think there are any lessons learned that can be applied there in terms of, I guess, the end user, things like political will, kind of how to bring those together and maybe elicit more of a response, I guess? Maybe, I don't know if I'm...
Yeah, no, I get your point.
You kind of know where I'm going with that.
I think there probably is a bit of a perception that there have been kind of, weather-based forecasting systems for infectious diseases before. I mean, some do exist certainly in Africa, for example. I think the Caribbean, there are some so there are some locations where they are working, and generally it's thought that's because the kind of human-to-human transmitted diseases, vector-borne diseases, are a little bit of a simpler system than the ones that we're looking at, where there are multiple mosquito species and multiple animal reservoir hosts. So it's a little bit more complicated. But I think that it's certainly clear, and I'll re-emphasize the idea that there's just still a lot of work to do on these to really produce something that is at least quasi-operational, and I'm trying to think of the correct word in this sort of line of from kind of research idea to implementation. There is an appropriate word for it, which I can't think of right now. But there has to be a willingness, as you say, to take them on, which often means changing the way you do business, and that is a potential barrier to adoption of early warning systems. But that is certainly going to be surmounting that barrier is helped by early warning systems that are well developed, have a logical advantage, or gives logical advantage to existing systems, and is pretty accurate. I'm not sure if I answered it in total there.
Yeah, I think that's great. Thank you.
Thank you. Let's keep that microphone in the audience so that we can just rotate. There's actually a very interesting question from Amr Fazil, Dr. Fazil. It's actually a colleague of Nick, I think. Amar, are you raising the question to a specific panelist, or you want to ignite some general discussion among everyone?
Thanks. Yeah, and it's no, it wasn't directed at anyone. It was just an observation or a comment about integrated systems. So all the panelists discussed sort of systems that are focused on trying to detect signals, sort of as an early warning systems. But I was just wondering, I guess, for discussion, what everyone thinks about sort of the value of systems that integrate these early warning signals in the attempt to try to improve sort of the interpretation of those signals, or provide an earlier signal than any one of those systems by themselves might be able to provide.
Yeah, I think that's a very interesting question. If you, data integration has, whole range of, integrated system has this whole range of spectrums. We have data integration, we have different aspects or spectrum integration where we have animal surveillance, where the data feeds into prediction, feeds into evaluation about the risk, how much risk it is to the human population. Then into the human population, what's the likelihood that it's going to settle locally? What's the likelihood it's going to spread around the world? So just from the scientific point of view, it's a huge system that needs integration. And of course, data integration, we need all sorts of data. That each data may contain some weak signals, but if we look at a broader range, we're going to see much stronger signal. That's a hope that we want to address. So this is actually a great question that we certainly want to address in this workshop. We want to start the discussion today, and if we can, we will actually concentrate more of these in tomorrow's discussion too. So I would like to know if anyone in the audience or in the panelists would like to respond. So yeah, maybe.
Yeah. So
let's start with introducing yourself.
Yes. My name is Mauricio Santillana. I'm affiliated to both Northeastern University and Harvard University. My team has for multiple years focused on precisely the data integration aspect of early warning systems. With and I guess the main finding we have come to is the fact that when you combine multiple data sources, you in fact do gain more robustness. In other words, you reduce false alarms. And I think Nick may be saying goodbye, or somebody from the panel. Yes. But yeah, so we've done this with influenza, we've done this with COVID-19, we've done this with dengue fever, malaria, and all our systems point to the fact that when you look at what people are searching, what clinicians are searching, what people are reporting in crowdsource apps for symptoms, what people are tweeting about, the number of people that are moving from one place to the other, etc. And you see where I'm going. Like, say you have 10 different data sources, and all of them are seeing an anomaly in the direction that you should worry. Then the more you have, it's also easier to convince a decision maker to actually take action when they see this, and you show them that in the past, you've seen that when all these data sources are in alignment, you've seen, for example, disastrous outcomes. So the answer is yes. This data fusion idea has been part of the research community for a while, and we have a lot of papers written on that. And I'd be happy to share some of our experiences discussing with public health officials and city mayors and governors, and what their response has been. Thank you.
Thank you, Mariko. Do we have other inputs from the audience, or online or in person? Yeah, thank you. Steve?
Thank you for the very interesting observations and comments, and thank you for data integration. One question I think we all struggle with is, if you have an early warning system, at what point do you have confidence that you can act on the data, that you can act on the signal?
It's an interesting question. Do you direct this question to the audience or to Barry? Everyone.
Anyone who wants to answer it.
I can tell you a bit of our experience.
Okay, so.
So during COVID-19 in the Boston area, we were invited a collection of experts in epidemiology or in epidemiological surveillance, and we knew that COVID-19 had left Wuhan. We knew that COVID-19 was affecting Iran and France in really bad ways, and we knew that it was already in Boston. So when all the other signals that they basically served as confirmatory signals that things were upon us now, right? So I think that there's a difference between, so there's a threshold that one could look into an index that combines things, but there's also the timeliness of when people were already they were already thinking about action, and so you provide this extra drop, and that's what happened. So I'm partially answering your question in the sense that I'm not providing an objective response of at what point do you, but I'm talking about more the circumstances under which these systems can actually lead to action, because there was already this momentum, and all we needed was just this confirmatory signal that instead of waiting 2 more weeks, we say, let's just do it now. Let's close the city right this moment, if that makes sense.
Steve Morris, I think that's a very interesting point, and thank you for these thoughts. What about early? If we're talking about early warning, how early in an event would we consider it that we have enough information to be able to do something, such as in the very early stages of the SARS coronavirus 2 pandemic? That's very hypothetical, of course, but when do we have the confidence, and what do we need to have the confidence that we have actionable information? A very naive question, I know, but.
So
I'd like to pick up on that.
Sorry, Amber just raised. So.
Did you want me to go ahead, or should I wait?
I have a second version of that question too that might help focus things as well. So one thing that we grapple with is the multiple hypothesis problem. We know especially because I look at news during the day often, every day there's a news article that comes out and says, this weird cancer is associated with this gene, and most of those are not replicable papers. And so I wonder, as we go towards a data fusion approach and trying to answer the same question, how do we trust it, especially given that we know that we're adding more and more hypotheses?
That's an interesting question. Amber, do you have anything you want to add, or you have a different question?
No, it was just an attempt to respond to the question. I think I think the willingness and the ability to act and the timeframes of acting will vary depending upon and unfortunately, science isn't the only driver in any of these things. So the political climate and the amount of political capital that may have been expended will dictate a willingness to act and the level of the signal at which that action takes place. I think even if you look at the experience over the past 3 years, I would suggested, many governments at this point are unlikely to put in public health measures that they might have been more likely to put in a year ago. So, the signals may be the same, but the action or the response to those signals can be drastically different depending upon political environment and public opinion.
Yeah, thank you, Emma. It's a very interesting point, and also means that these questions are also closely related to policymakers, how they make policy using the input from modelers from different research groups or from public health expertise themselves. So I wonder if in the audience there are, we certainly have day three's discussion mostly concentrating on policies, especially interaction with government. But I still would like to know if currently in the audience, anyone would want to comment on how the government officials or different agencies are making decisions, or what's the process, how do they use the inputs from different groups, or something related to that.
So I by no means am I a full expert on this, but I would like to think that a single warning will not trigger an immediate response. I think, or at least not an immediate intervention. It will trigger a response in the sense of searching for more data, searching for better data. So at least knowing where you need to look to get the information you need to model your intervention upon. If you don't have an early warning, any warning will be the first one. So the earlier your warning comes, the better you are equipped to follow a situation and have your response ready. So I hope that might make sense in the context of what we're talking about here.
Yeah, that's an interesting point. That also raises the importance that integrated systems are very useful, because we're not only looking at one signal, maybe other signals are popping up from other places that would probably strengthen the signal. Other input? Yeah, Dongmei?
Yeah, I'm Dongmei. I'm from Queens. Maybe I can just probably comment on some of those kind of early warnings. I remember many years ago, just right after the SARS, I think Ontario government have been established, set up warning systems called syndromic surveillance systems, based on the data from more of hospital and then or the emergency room, to look at all of those kind of, for example, respiratory disease, different type of the disease, to look at the number of the cases, what's the trend, and then the look at the increase, and when they went to a certain point by compare with the normal of the level, and then they come up a warning sign and then to send that message to whatever, the management or government, to whoever in charge of those, to look at the detail of these cases. And then they will also lead to, I think, the one very important thing is not just total number, also you need to look at is the spatial, where those cases are located, and whether there is, for example, if the respiratory is, if they're infected, and then whether there is a cluster, for example, we expect it if it's infected, and then the people will be contact with, through this contact, and then there will be come up clusters, right? So you need to look at from the different aspect to get this warning to COR at what point, and then you need to check, and then there is alarming coming out. But I think it's a very interesting thing I found is this kind of warning systems is already there. Okay, it's not like we never had a warning system. We have the warning systems already established there. And the thing is, we just needed to add in more to enhance those kind of the early warning systems to make it work better. But what I found it is interesting is every time when we have pandemic or whatever, the outbreak, and then the government or research community start to kind of, jump in, and then seems to put a lot of resources on that. But after the end of that, and seems everyone just, oh, okay, it's gone, and then no one pay attention on that. So that's something, I think that's a question which I feel, from the research community and also from the public, the government agencies, we need some kind of mechanism to keep those kind of the warning systems, to make it, like keep working and keep improving, and not just every time, we have a pandemic, we started to kind of, again, to talk about, how important those kind of the systems are. So maybe this is the questions or something needs to be discussed, or, in more about, what kind of strategies the government or the research company should be, implemented to make those kind of the early warning work, the warning systems really work.
Okay, thank you. Any responses or other questions? Well, I think actually Barry just responded in the chat window that integrated systems may have the advantage of introducing redundancy. If one of the data streams becomes unavailable for one reason or another, other sources may automatically pick it up. That's an interesting comment. Barry, do you want to elaborate on that?
Not necessarily, but I've seen some examples from the past where in a system that tracked a certain community outbreak diseases, some of the data sources stopped reporting. And if an algorithm completely relies on that single data source and there's no further reports, which in the worst case might not even be detected, then your entire system will fall apart right away. In an integrated system with data fusion capacities should be a lot more robust for such outages. And those outages might be accidental, but they might be intentional as well. We will never know.
Great, thank you. Other comments or questions from the audience? Yes. Again, introduce yourself.
Yeah. Hi, my name is Yogita and I'm postdoc at University of Victoria. So my question is about if we integrating so many data sources, so how can we check the data quality and ensure that and validate for these early warning signals? So it's like about the data quality, how we can validate and ensure, because we are integrating so many resources from various websites. Yeah, so this is my question.
Any response from the audience?
Thank you. So what we've done in the past is that we have explored the usefulness of each individual data source in their predictive power. And it is only then, after we have tested that each individual component can serve as an early warning signal, that we bring them together. And then we quantify to what extent the sum of all these signals can yield a better system. So I agree with you that one needs to have some data quality. Yes, yes. Of course. Yes. What we do know, and we can do it. It takes time and effort, but it can be done. Yes, exactly. Yeah, we don't just throw everything into the blender and see what happens. We know that each individual signal has worked in some capacity in the past, but as Barry was saying, we try to not rely on a single one, because we know that, who knows, Twitter may be gone in the coming months. It's meant to be a joke that may materialize. So with all the love we may have for, anyways. Sorry.
Thank you. Other responses? Okay. All right. I guess one thing that we haven't really come into is we have discussed a lot of early warning systems ranging from, for example, the expertise, opinions, for example, the ProMed, for example, GFIN is sort of in that aspect too. We have wastewater, we have environmental surveillance, we have social media. So we have all sorts of things, but I'm sure it's not completed list. I'm wondering if the audience want to discuss some other systems that we haven't discussed, giving us an example that's something maybe we haven't heard. No one wants to step up. Maybe we're very, our coverage is very broad today. Yeah, another thing that we actually kind of interested in is the integrated system. Again, data integration is a key part of it, where we can integrate different type of data, not just different type of social media data. Maybe we can include case surveillance. Maybe we can include environmental surveillance. The different more aspect we can include. Maybe we can pick up different aspects of the signal to give us a stronger signal. And another type of thing is, well, different early warning systems may be good at different things. Like wastewater is really good at showing us that the pathogen is already in the population. But there are other things like the how do we correlate it to the prevalence or predict the spread of the virus, things like that. But we have different early warning systems we can integrate. If we use the signal from here as the input to other signals, and we integrate different aspects of the early warning systems, maybe we can give a better picture of things going on. And it might give us something more solid to the public health. Otherwise, if we just have one signal, it's not clear whether the signal is important. We just discussed that. But if we have this signal, which could mean some other things more significant from other aspects, we're giving a stronger a signal to the decision makers. So, of course, the hope is we bring all these expertise, so that eventually we will have a way or path that we can develop these things together, so that we have a collaboration in this field. Wonder if anyone have any comment on this aspect, or again, Sajjad, introduce yourself.
I'm Sajjad Rahimi. So I just wanted to add a comment about the integrative models or data, because when we have multiple sources of the data, I think the integrative idea has two folds. The first fold is to integrate the data, as we were discussing before, but the other approach could be integrating the models. So for each source of the data, we can build a model, and then with the machine learning techniques like boosting, bagging, or even stack generalization, you can take the output of each model corresponding to each data set and combine it in that way. So even in that case, if there is an anomaly detection models, we can take all the outputs, and if there is only one data set corresponding to the best signal, we can detect it as a sort of anomaly detection from the output of all the models that we already built on top of the data sources that we have. So I think it's a sort of trade-off between integrating the data or the models. So that would be interesting questions to answer, because I think for the early warning systems, this is very important. That this can play a very important role in detecting the early warning signals.
Great, interesting. Thank you for the comment. Anyone wants to follow up on this?
Okay.
Yeah, Steve?
No, I was just going to make a comparison. It is Steve Morse, Columbia. It is an interesting comment. A number of political polling operations have done this. So Real Clear Politics, of course, very famously, Nate Silver in 538, averaged the results rather than averaging the raw data. So that I don't know if anyone's tried that, but it's an interesting question. Has anyone tried that? I know there are model competitions that CDC has, for example, but those are on individual models, as I understand.
Yeah, so we've done what you have proposed, and we did this in 2015, and multiple other teams that work with the CDC in the US have been receptive about this, and now the standard, the baseline for this CDC competition you're referring to, is to report the ensemble. That means you build different models that each of them may use different data sources, and then you combine them in multiple ways, because you could take the average, you could take the winner takes all, you could do a weighted average based on performance, you could do many things, right? The bottom line is that now that is the standard in the community. So yes, that is what people do nowadays. So your idea is good, I guess, from the perspective that it's not only good, it has been tested to be good. So yeah.
Great, thank you.
That's now the standard in the field. Is there any sort of guidelines about which methods work best, or are there methods that work better than others, or are they all subject to the same sorts of errors? They're different error types.
Yes, so in an ideal scenario, you have models that perform better, but they're all complementary. Like if you were talking about linear algebra, they're linearly independent in a way, and maybe one approximates best the solution. But sometimes what we observe is that certain models are very good for a certain disease in a certain location, in a certain time. And then those same properties of being the best performer is not always persistent. It's not like an invariant. And so you may need to be open to dynamically learn. That's where the machine learning aspect comes to be useful. You reassess the weights, or you reassess which you trust the most. And this goes back to your point, Julian, in terms of the tasks, right? In machine learning, we call those tasks. Like first is presence of a pathogen, then volume, like burden overall in a time period, the integral of, right? But then there's a derivative at a given point in time, and which model may be best at giving you the best task tends to change from disease to disease, location to location, time to time.
Thank you.
Thank you.
Well, actually, I really hate it, but I do have to stop us right now for this session because we're way overdue for our coffee break. So let's take a 20 minutes coffee break and come back at 4:15. Sorry, 3:45. My brain doesn't work. Thank you, everyone, and thank you for our panel.